here is TJ Johnson. He is a frequent speaker to Launchpad and a wonderful friend to Launchpad. One of the things that we offer at the end of this is 33 months of free YMCA membership services, and TJ was able to arrange that through an interesting woman named Cinnamon. But TJ has at least 2 areas of expertise, one of which is networking, and he has a great presentation on networking, especially networking for introverts. But during this time of year, he takes off the networking hat and puts on the I'm an insurance expert hat. And because this is open enrollment for affordable health care, he's going to talk to us about the latest and greatest trends in affordable health care and what the recent election might, the implications of that election and how it might impact affordable health care. Let's give it up for TJ Johnson.
Just a quick note on that, the phone number is correct, the address is wrong. My new cards are out, and which have my email address, my website, all that kind of stuff on it. So we'll get that one changed out as soon as possible. So some of you know I've been speaking with Launchpad and working with most of the jobs clubs here in Austin for about coming up on I think 4 years. This time of year, a lot of questions going on. So disclaimer is, I'm not here to tell you what's going to happen. I'm not here to debate the pros and cons of the ACA. I am going to clear up a couple of things. If you have health insurance through a group or individually or whatever in the United States right now, you're all in Obamacare, okay? So please don't come to me and say, I don't want an Obamacare plan. There is no such thing. Even if you're on group, there's still ACA compliant Obamacare plans, period. The ruling party now has already conceded that there's no such thing as repeal on day one. It's not going to happen. It can't be unraveled. It can't be done. What they're saying now is, what their plan now is, and this is off of, this is from a couple different sources, but Trump apparently already, he has a website up. It's called a Trump presidency or something like that. And they've already, and then one of the tags is healthcare, and they've already basically conceded, there's no, he promised repeal Obamacare on day one. They've already conceded that it's not going to happen. 2017 is probably going to stay fairly the same. There's going to be some rumbling and some other things going on. 2018 is when some of the things will start to probably take effect, but we don't know what's going to take effect. 2017, the reason I say things will probably stay the same is even if they start passing, even if on day 2 they repealed the whole thing, the insurance companies would put their foot down and say, look, you can't, there's nothing we can do. There's no other plans. We can't just kick everybody out. It's not going to happen. So 2017 is going to stay pretty much the way it is. So I'm here to tell you what the rules and the regulations for 2017 are. What's probably going to happen is what the industry is saying is that they're going to tweak things as they go along. It's one of those things where we got to pass it to find out what's in it kind of deal. Just like back in 2010. You can't really just roll it up and say, okay, all 18 million of you no longer have health insurance. It's not, everybody understands that. So where do we stand today? So I'm going to go over a couple things, and then the big questions are who's around, who can we get insurance through, how do we do it, and how do I qualify for a subsidy? Those tend to be the big questions. So the easiest point on that one this year is very, very simple. There's only three players in Texas, period. There's Blue Cross Blue Shield, there's Ambetter, which is underwritten by Superior Healthcare, and then there's Sendero. And those are the only 3 players. There's some Scott & White stuff if you live in that area, but I'm not really going to address that today. I'm talking about on exchange because that's where most of the people are going to do their shopping. And that's it. Humana's gone, United Healthcare is gone, Aetna's gone, Cigna's gone, everybody's gone. They're not even here. You cannot get an individual plan from any of those, from any carriers other than Sendero, Ambetter, and Blue Cross Blue Shield in Travis, Williamson, in the greater Austin area, period. Another thing I'm going to tell you, I knew that this was the deal, and if you read my website, there's a little piece about it, but somebody approached me this morning. If you go on and you want to get quotes through the internet, and you enter in all your information, you're going to get about 10,000 phone calls from every insurance person on the planet. Those of you that know me know that I don't talk bad about other insurance companies. I'm a broker, so I deal with everybody. I'm not aligned with any particular company. If you get a call from Health Markets, and I apologize if there's a Health Market agent in here because they're all over the place. They do not sell health insurance. They don't care what they tell you on the phone. If you go to their website and you read it, at the very, very bottom, there's a disclaimer that says, this does not count as essential health care under the ACA. If you sign up for their plan, you are still going to get hit with the individual mandate penalty because it is not health insurance. The only reason that I'm so adamant about this is because they're everywhere. They're in BNI, they're in networking groups, they're selling it, they're somehow embedded. I had a client that called me that told me that they were talking to Aetna on the phone. Aetna, the actual Aetna insurance company, and Aetna referred them to Health Markets. And so I don't know how they get embedded in that, but it's just the way it is. Health Markets sells an indemnity plan. If you're looking on the exchange and Blue Cross Blue Shield is $500 a month, and Health Market says, oh, I can get you a zero deductible plan for $150 a month, it is not the same thing. All the numbers are relatively the same. Just be very, very careful if you get on the phone with Health Markets, because they're going to swear up and down that it's health insurance, that it covers this, and you can ask them point blank. I'm not speaking for all our agents, but you can ask them point blank, does this count as essential health benefits under the ACA? And they're going to say yes. It's not. If the price is that much different, it's not what you get and you're not getting what you think you're getting. I'm not saying that those programs and those plans don't have their place, because they do, but it does not count as health insurance. I just want to get that clear that up, because you're going to get, if you do an online quote, you're going to get a call from one of them, I guarantee you that. So they say, who in here has a healthcare.gov marketplace account from the last couple of years? Who has, there's a new page on there that says, when you're going through the application, so the first few pages of the application, do you guys want me to walk you through healthcare.gov real quick? Take a couple minutes?
Yeah.
Okay, so you're gonna get on healthcare.gov and you're gonna say start new application, you're gonna go to Texas and then do drop down. Then the first thing that they're gonna do is they're gonna ask you, you have to have an email. Please do not forget your password once you set it up, because it's a pain in the butt if you forget it and you gotta call them and then you gotta wait, and then they email you this and you gotta wait. And during the crazy time right now, it can take up to 72 hours to get your password reset. So make sure you write everything down. They're gonna ask you some security questions. Then, if you have a name like mine, which is Thomas Johnson, you're going to go to another set of questions that's called identity proofing. And it's going to ask you weird stuff, and you're going to get freaked out because of all the stuff that the government knows about you. It's going to ask you things like, prior to 2006, you bought what kind of car? And it'll list 4 cars, and they're going to know. It's going to say, you used to live in what county? Your phone number used to be something like that. So don't worry about it, you just have to answer it. They know all that information in here. They're pulling it from the IRS and a whole bunch of other stuff, and your credit report and a bunch of other nonsense. So then you're going to get through identity proofing and said, congratulations, you've been identified. Then you're going to go through and you're going to fill out, and they've changed it from last year, but you're going to go through and fill out your personal information, name, date of birth, address, how many people you want to insure, that sort of thing. It's going to take you all through that, which is all fine. Now, where it starts to get a little bit sticky is a couple of different places. There's a couple of weird questions in there. Most of them are related to income, but there's a couple of weird ones. When they're talking about household, so say you live with a member that's on Medicare or something like that. They're still entered in as your household. It'll all aggregate later on. Because when it asks you how many people in your household, don't think that because you're the only one getting insurance, that you're the only one you have to put down. Now, conversely, if you live in an apartment, or you rent out a room to your house or something like that, and the other person is an adult and files their own taxes. Also, if you live with an adult child that files their own taxes, then you're 2 separate households. Right? Because it's all, when you get to the aggregator that tries to figure out what your subsidy is going to be, it's adding all those incomes together. And you only have to add the incomes together on your dependents if you're claiming them as a dependent. If they're 30 years old and they have a job and they file their own taxes, you can have multiple households within one house. But if you're married and you're filing a joint tax return, then you're considered one household, the both of you. Or if you're still claiming your children, then you're all considered under the same household. And so say you have a 21-year-old that works part-time and makes about $15,000 a year, that's all going to have to be added together because you're still claiming them. That's all gonna have to be added together. If you're claiming as a dependent, and you're claiming them as a write-off, then whatever income they're making counts towards the household income. So when you get all the way down, the hard part's gonna be when you get down and you get to the income calculator, because this is where it gets a little confusing. So I'll go over the most common things I see and the most common issues I see with job club people. If you're on unemployment, and let's just say you're only gonna get this, remember, we're only talking about 2017 income. What you made in 2016 doesn't matter. There's gonna be a question that says, do you think you're gonna make the same as you made in 2016? If the answer is no, it's no. If it's yes, it's yes. But we're talking about, when we're talking about getting a subsidy for 2017, it's what your projected income for 2017 is. It has nothing to do with the fact that you made $150,000 last year and got laid off. It's what you expect to make in 2017. So if you're on unemployment and you have, let's say, 4 months left and it's going to run out in the end of April, when you go to enter your income, what you're going to have to do is you're going to have to take the total amount that you're going to make January, February, March, and April and add it together. And you're going to enter that amount, and then there's going to give you a drop down and it's going to say, how often do you get this? And you're going to have to put yearly. What happens is if you enter in your month, say you get $1,600 a month, it's going to automatically calculate $1,600 a month for 12 months. It's just the way it works. There is no other way to do it. So when the other thing that's going to freak you out is when you put in that 4 months worth, it's going to amortize it over 12 months. So then there's going to be another screen that says, according to what you put in, you're going to make $682 a month. Don't worry about it. All that matters is the total amount of money that you're entering in. So again, if you're going to get 6 months, take whatever you're going to make for 6 months and add it, put it in there and put it in as yearly. And then, like I say, it's going to tell you, it's going to say, TJ Johnson, according to what you've entered, you're going to make X amount yearly, which equates to this amount a month. Don't worry about it. It's just the way and I've called them and said, why does it work this way? And they said, that's just the way the program is written. So that's one of the most common things. If, say, you got laid off and you're going to get some sort of bonus or severance or something like that in 2017, we're a little early in the year to be still getting bonuses in 2017, you have to count that. That counts as income. These are just common things that I'm seeing. People coming out of Dallas that they get bonuses in the background. Any other questions upon subsidy eligibility? So the subsidy... Go ahead. The subsidy eligibility is based upon FPL, which is federal poverty level. Now you have to fall between 100% and 400% of federal poverty level. And it changes, just so you know, if you're a single person, 100% of federal poverty level is about $12,800 a year. If you say, well, I'm not going to make any money at all in 2017 unless I have a job, what's going to happen is you're going to get an eligibility determination that says it doesn't look like you're eligible for any help. The reason for that is back when the ACA was passed, Medicaid was supposed to be expanded in all states. And the Supreme Court came through and said that's unconstitutional. The states are allowed to decide whether or not they're going to expand the Medicaid ranks to those people that are between 18 and 65. And there was 22 states that said, well, we're not expanding anything, we're going to leave it the way it is. So what happens is if you fall under 100% of the federal poverty level, you fall into the Medicaid black hole, which is you're not going to get Medicaid because you don't qualify based on your age, and you're not going to get a subsidy because the calculator says that you should be on Medicaid. So somehow you have to show an income of $12,500 or $12,800 in order to get a subsidy. And then it goes up from there. It's maxed out for a single person. It's maxed out at $46,000. 2 people, I think it's 62. 3 people, it's 74. 4 people, it's 91. 5 people, it's 116 or something like that. Anyway, but you have to fall between that 100 and 400%. And the closer you get to the 400%, the smaller your subsidy is going to be. Now, there's some backdoor, tricky ways to qualify for that $12,500. If you say, I'm just going to live, I have plenty of savings, I'm fine. Well, you're not going to qualify because savings doesn't count. Remember, this is all aggregated by the IRS. So if you're not paying taxes on the money, according to the government, you're not making it. So you're going to have to figure out some way to get a taxable income of $12,500 in order to get a subsidy. Now, there's some backdoor ways of doing this. One of them is to draw money out of an IRA, a traditional IRA or traditional 401k. Not ideal, I understand that. If you're under 59 and a half, you're gonna get hit with a penalty, and you're gonna pay taxes on it. I understand that. I'm just telling you, it's a way to do it. The real back way to do it, is if you have a traditional IRA or if you have a traditional 401k, you can convert $12,500 of that to a Roth, which counts as a taxable event, which means you're going to pay taxes on it. But you're not going to get hit with a 10% penalty. And the money stays in a retirement account. And if you're not working, converting this amount during a year that you're not working is particularly good because you're not going to pay taxes on it anyway because your income's going to be so low. It sounds backwards, but it works. It's completely legal. Okay? And you don't have to spend the money. There's nothing that says that after you convert the money over to a Roth, you have to spend it. If you're going to live off savings, you can still live off savings. There's no reason that you have to spend it. If for some reason you don't want to do that, or you're like, well, I don't have any savings, I'm going to have to draw money out of my retirement account if I don't get a job, but I'm not going to do that unless I don't get a job. What you can do is you can do to that drop down screen, and it says add an additional source of income, and you're going to put retirement, and you're going to put $12,500. You're going to put $1,100, and you're going to put monthly. And then you don't actually have to draw the money out until the end of the year. So say, for instance, you have enough in savings, but you want to qualify for a subsidy, but you plan on getting a job, and if you don't get a job, you're going to get a part-time job, something to pay the bill, but you want to qualify for the subsidy. You can tell the government that you're going to pull money out of your retirement account because you're going to need it to live on. And then if you get a job, simply never pull the money out, because once you get a job, you're not eligible for the subsidy anyway. You have to call in and change it anyway. So then what's going to happen if you use some of these backdoor things? What's going to happen is when it spits out your subsidy eligibility, you're going to get a little box on there, and it's on the top of page 2 that says, you need to send the marketplace more information. Now, if you're on unemployment, that's easy. You simply send them a stub from your unemployment. The reason that's happening, there's 2 reasons that happens. For those of you that were recently laid off and were making $80,000 last year, according to the calculator, it looks at it like, wait a minute, you made $80,000 last year, now you're telling me you're going to make $12,000? Why? The other thing that happens is, if you've been unemployed for a long time, and you've reported no income, and all of a sudden next year you're going to report $12,500, it's saying, well, wait a minute, you don't have a job, so where are you going to get this $12,500 from? So this is where it gets a little sticky if you're using some of the backdoor things. If it's unemployment, that's no problem. You just send them that. Now, be aware that if your unemployment is going to be under $12,500 and you only have $6,000 left of unemployment, you're not going to meet that $12,500 threshold. So you may have to do a combination of a couple of different things. So when you get that, it's going to give you a big list of things that you can send in. It's going to say paycheck stuff, it's going to say W-2, it's going to say tax return from last year, and you're thinking, well, I don't have any of that stuff because I'm pulling it out of my retirement account and I haven't even done that yet. So what you're going to have to do is you're going to have to get on the phone, you have to call healthcare.gov, and you may have to call multiple times because this time of year, who's staffing the phones on that end is someone that just has a part-time job that makes $8 an hour that doesn't know how the whole system works. So depending on who you get, you may get someone that's been there for 5 years, you may get someone that's only been there for 5 days, you don't know. And you're going to say, look, I'm going to pull money out of my retirement account, and I'm going to pull it out X amount per month. And what I'm going to do is I'm going to send you a letter with a little Excel spreadsheet, and it's going to tell you exactly how much I'm going to pull out every single month. Because they don't have a form for it. There's no form that you can just send in. And they're either going to say, okay, that sounds great, or they're going to say, hold on a second. And if they say, hold on a second, you're going to get a supervisor, and then you're going to explain the whole thing. It works. It's perfectly legal. You can do it. You just have to hope that you get the right person on the other end of the line. You have 90 days to do it from when you fill out your application. Then what happens is, let's say, for instance, you don't really need that because you're actually going to live off savings. So it doesn't really matter. Your intention is never to actually pull that money out. But you had to put it on there so you could qualify for the subsidy. You can simply wait until the end of the year. So if it gets to be December 15th and you haven't made any money and you still really need to make that $12,500 threshold, you can pull it all out then. There's no you don't actually need to pull it out month to month like you tell them you're going to. But remember, this is a huge numbers aggregator. So the guy that's talking to you on the phone just needs to be able to turn to his boss and go, hey man, the numbers work. And he needs to be able to turn to his boss and say, hey, according to the numbers work. And on up the food chain until they get to the top, and the top guy goes, okay, the numbers work, it doesn't really matter. That's all you're trying to do. This is all just a numbers game, so don't worry about the nuts and bolts and the other things that go on. It's all just a numbers game. So any questions about any of that? Other than you have to get to about 12,500, 12,700. And it goes up. So if it's two of you, if it's you and your spouse, that 100% of federal poverty level is higher. And you can just type it in, you can just do a Google search, say federal poverty level, and it'll tell you what the threshold is. I can tell you that if you're going to come in right around 12,500 or something like that, there's going to be a little bit more scrutiny on you than if you put in you're going to make 26,000. Because at $12,500, at the very bottom of the threshold, your health care is going to basically be free, depending upon what plan you're in. I saw a plan that came in the other day at about $4.29.
So those of us who select Cobra, because we're a resource from our company, how long does Cobra last?
Okay, so Cobra lasts 18 months, and here's the tricky part with Cobra.
From the day you're laid off, or from the day you convert to Cobra?
No, it'll usually be your Cobra usually start the first of the month following the month you were laid off, and it's 18 months from that day. This gets a little bit sticky for those of you that are coming out of like Dell and AMD and stuff like that, because what they do is they subsidize your Cobra and don't fall into this trap. If you got laid off from Dell and you got your Cobra notification, it's exactly the same as what you were paying when you were working, understand that that's going to change in 90 or 180 days because they're subsidizing it. They're paying it for you. So you need to call ahead and call your HR and Cobra department and say, look, what is this going to be when it goes full blown? Because that's what's going to happen.
Probably double.
Yeah, if not more. Did you?
I did, but you can answer his.
Okay, well, okay.
Do you have more on that?
No, I'm digressing.
Okay. Well, my question was, Foundation Communities does free tax preparation, and they said that they do it all. They'll sit down with you, they'll fill out the forms, they'll do it all for you. Can they, what you're telling us is a little bit complicated, and I would assume that maybe Foundation Communities is used to doing simpler tax.
I mean, if you went in, I can't speak to that for sure. If you went in and told them, look, this is what I'm planning on doing, it's all perfectly legal, and the numbers all work perfectly well. So I would be hard pressed to say with the number of people that they do every year, I'd be hard pressed to say that it's never come up for them before. Again, you may have to go through until you get to the right person, but I would be hard pressed to say that they haven't seen some sort of form of that before. Because these are the games that everybody's playing. So my guess would be that they probably have seen it.
I had a question about Cobra. What are the rules about changing your plan while you're on the Cobra?
You cannot change your plan. You Cobra, you're locked into. So Cobra is an extension of the group plan that you had at work. And any changes that you can't make any changes at all. So here's one thing you can do. Say that you're on Cobra and it's me and my wife and my 2 kids. And it goes to full blown and I have some health issues, but my kids and my wife are very, very healthy. As long as the principal, whoever the employee was, stays on Cobra, everybody else can drop and get their own plan. The reason that that's advantageous is because for 2 reasons. A, the plans for Dell and those places are usually pretty robust. And you may not need that robust a plan, that's the industry term, robust. You may not need that robust a plan for your healthier younger members or your family. So there's not necessarily a reason to pay for it. The other thing about Cobra is Cobra you pay 102 to 103% of the actual rate of the health insurance. So you're actually paying more for Cobra than the actual cost of the plan, and that's because there's administrative fees and a bunch of other stuff written into them naturally. The principal has to stay on there. The other thing that you can do is you can keep your dental and your vision and drop your health care. So you can keep your dental and vision through Cobra because you really like it, you've satisfied your waiting period, all that kind of stuff, your doctors are all in network. Drop that and then get a subsidy through healthcare.gov to get your healthcare subsidized.
What if the Cobra ends middle of the year?
Cobra ends middle of the year, that counts as a qualifying event, a special enrollment period, so you can sign up then. Here's the trap that you run into. You get laid off in February. from Dell, and you get your Cobra notification, like, oh, sweet, I'm still only paying $500 for me and my family. February goes by, March goes by, and April goes by, and all of a sudden you get the notification, and now your Cobra's $1,600. And you're like, well, I can't afford this, I'm not gonna pay it. Voluntarily dropping your coverage, whether it's Cobra, whether it's through the exchange, anything like, does not count as a special enrollment period. If you drop Cobra in June because it's too expensive, you cannot get health insurance until the first of the year. So be very, very careful. And that happens to a lot of the people coming out of Dell. They're like, well, I'm just going to stay on my Cobra for the first 3 months because it's super cheap. I said, but if your Cobra, if your subsidized Cobra terminates outside of open enrollment for the ACA, which is November 1st to January 31st, and you decide to drop it because you can't afford it or don't want to pay it, it does not qualify you for a special enrollment period. If your Cobra terminates, you run out of month 18, that counts as a special enrollment period. That counts as a qualifying loss of coverage. So be very, very careful with that. I know it's tricky because you're like, well, I can save a lot of money. I don't necessarily want to sign up for something more expensive because what if I get a job in the next 90 days? Then I don't want to have to pay for that. I understand that. This is kind of that's the way the rules are written.
So right now, your enrollment, people who got laid off, they already went through their corporate enrollment and had signed up for what they were going to do next year. But we're not actually,
Right. So those benefits haven't started yet.
yeah, they haven't started yet. So
Right.
can you still cancel that?
It'll automatically terminate. If you're no longer an employee there, you just won't get covered. January 1 will roll around.
No, they sent us the enrollment in October, and many of us enrolled for 2017.
Oh, for Cobra.
Yeah.
Yes, you can still terminate. Or you can play the Cobra game, right? If you're fairly certain that you're going to get a job, or now this is dangerous, but I'm telling you this is an option for you. If you reasonably got laid off and you're reasonably healthy, and you don't anticipate anything happening, and you're fairly certain that you're going to get a job within the next 90 days, you can play the Cobra game, which states that Cobra you can back pay. So let's say I get laid off on January 1st, and I have until March 31st to sign up for Cobra. And I say, well, I don't want to spend the extra $500 right now. I don't have it, I'm laid off. And let's say we get to March 18th, and I get in a car accident. Now, I haven't signed up for Cobra yet, and I don't have a job yet. But the law and the rules for Cobra state that as long as I back pay my premiums, January, February, and March, my Cobra is reinstated. You have 90 days or sometimes 60 days to play the Cobra game. So you can defer paying it and hope that nothing happens. And if you get a job within that time period, then you're going to get a new benefit, right, with your new job. And if you don't, you can always back pay it. But keep in mind that you'll have to pay all the back premiums on it. But for some clients, that works, particularly now, because let's say you got laid off now, right? And you're hoping that end of November, December hiring's rough. Second week in January, it's going to pick up again. You're going to get a job second week in January. You have until January 31st to sign up for Cobra. You want to go through the holidays, you don't want to have that extra $500 bill. Now, you can get all the way till January 29th. On January 29th, you can sign up. You don't have a job yet. You don't want to pay for Cobra. You can sign up through the ACA and get your subsidy. Your coverage will start March 1st. Or, you can go back, something happens during January, you can go back and back pay your Cobra, and now you're covered.
And then you do that even after the subsidy, or at that point in time, the subsidies end. So some people have like 6 months of subsidized Cobra.
Right.
So they're saying they don't want to pay the triple amount after that. Can they stop paying it and then for 90 days? Or
Yes, okay, so if you can always stop paying your amount and it'll terminate, whether it's subsidized or not. But if it falls outside of open enrollment and you stop paying, you're not going to be able to get coverage through the exchange or through the open market, as they say. Right? But you're saying you guys recently got laid off?
Yeah,
Right. So when does your Cobra sign up expiration?
December 1st it begins.
Your Cobra coverage starts December 1st?
Yeah, because my termination date is November 29th.
Okay. So
But we can talk offline.
okay, yeah, so technically you would have December and January to decide whether or not you wanted to actually sign up for COBRA.
Well, we already had enrollment.
Okay, but according to the law,
I don't know,
you have 30 days
after the termination.
after the termination. Any other questions about COBRA? I know it all starts to get a little bit confusing, but this is the kind of, it's not confusing to me.
Well, since you had like I understand that if you have a change, this is the COBRA, since they stopped the subsidy, there's a change because they increase your premium, you could drop it at that time and then.
Not if it's outside open enrollment. Voluntary termination of coverage because it's too expensive does not qualify, it's not a QLE, qualifying life event, which then qualifies you for an SCP, a special enrollment
But
period.
there is open enrollment for Marketplace from November 1st through January
Yes,
31st.
so if you fall within there and you decide to drop your coverage, then you can sign up.
So my enrollment in October really doesn't matter. Just when I get terminated, I actually do the COBRA, select COBRA.
Right, on that, when you get your COBRA, it'll tell you, if you don't sign up by this day, your coverage will automatically
I
terminate.
understand.
Yeah, you don't need to sign up.
So I can still do the ACA then?
Huh?
Understood.
Yes. Although if you've already signed up, they're gonna start drafting your premium for the COBRA right away on December 1st.
Yeah, I know.
Any other questions? Does everybody understand how to qualify subsidy-wise, or the basics of qualifying subsidy-wise? Just make sure that if you do, like I said, if you're doing unemployment or bonus, you put in yearly, not monthly, because it'll calculate it for all 12 months, and it'll mess it up. So it's gonna be based on a sliding scale, it's gonna be based upon, so if you have someone in, let's say you have someone that's on Medicare, your spouse is on Medicare or something, and it's really only you, it'll figure that out. Because there'll be a bunch of questions about, is anyone in your household on Medicare, that sort of thing. There's a really weird question on there that says, in the last 60 days, has anyone in your family been denied CHIP or Medicaid or anything like that? Generally speaking, the answer is no. The only reason they put that in there is that if you're contesting it. If you apply for Medicaid or CHIP and you got denied, then they want to know if you're in the process of contesting it.
So those plans that are now available in Texas, I heard people say they don't offer PPO.
No, so I'll get that in a second.
All right.
That's plan selection, which is the very last page of the deal. Let's talk about CHIP and Medicaid. The other thing is, if you're gonna fall under FPL and you just don't want insurance, then you're not under the individual mandate, you're not gonna get hit with a penalty. So if you're young and healthy and you're really only gonna make like $15,000 next year, because you're gonna go back to school or do some training or this and that, you're not gonna have to pay the individual mandate penalty anyway, you're gonna qualify for a hardship exemption. So if the issue is really that you just don't want healthcare, you just don't wanna pay for it, you can always apply for a hardship exemption. You got laid off, you don't have a job, there's a couple other ones, caring for a sick parent, death in the family, that sort of thing. So if you really just don't want it, you can always apply for a hardship exemption. Now, it's very hard to qualify for that if you're gonna make $80,000 and you say, I'm gonna qualify, I'll return to qualify for hardship exemption. 90% of it is based upon income. There are some other things that qualify you for it. Just, so there are ways, if you just don't want it, period, there are ways out. If you're relatively young and you're gonna make fairly close to the high end of the federal poverty level, your subsidy is going to be very, very little. It's all based on 9.5. 9.5 is the magic number. The ACA is not allowed you to charge you more than 9.5 of your gross income for healthcare. So as you get older, healthcare gets more expensive. And so therefore, you can make more money and qualify for a larger subsidy. If you're 24 years old, you're going to make 30 grand, you're not going to get hardly any subsidy at all anyway. You may get 50, 60 bucks a month.
So if you got subsidies and in mid-year next year you got a job, you have to
Yep.
pay back those subsidies?
Yeah, so let's say you qualify for subsidy, then you get a great job. You have to call the marketplace, say I have a change in income, or if you have a great job, you need to call them and say, look, I'm going to go on the group plan. I don't need this subsidy anymore. Yes. Depending upon what it is you're going to make, you're going to owe a prorated amount back to the government of that subsidy that you took. Now, it's prorated based upon what you're going to make. So if you get a job with full benefits, but you're only going to work from August through December, and you're going to make 20 grand, you're not going to owe that much back. It's based upon a sliding scale based upon what your income is going to be. The way it's supposed to work is that You don't have to, so say I get to the end of the year and the government says you make too much money, you owe us $1,500 in subsidy back. The way the law was written, it states that you don't cut a check, you don't write a check for that. You don't say IRS $1,500. The way that's supposed to work is that money is then taken out of whatever, it continues to roll over. There's no penalties, there's no interest attached to it. And that amount continues to roll over year over year over year until they can collect it back because you were supposed to get a refund or something like that. My understanding of the way that it's working is if you have your taxes done by H&R Block or something like that, they basically just say, no, this is what you owe. Because they don't have the software and they don't have any way of collecting the money from you later on because they can't file your taxes if you owe money. So the way that it was written and the way that it's working out don't necessarily mesh, which is a lot of the issue. If for some reason you should have gotten a larger subsidy, that will come as a tax credit. Now, in this particular case, it does work that way. The government does not send you a check. It just comes as a tax credit and it rolls over year after year after year. In the event that you owe taxes, they'll credit you that amount back, but they're not going to write you a check for that amount. When you go through, there's going to be a screen right before choose plans that says, how do you want to use your subsidy? There's going to be 3 choices. The first choice is going to be you use 100% of it month to month to get you the lowest month-to-month cost. There's going to be one in the middle that says use part of it. And then there's going to be the one at the end that says save it all until I file my taxes at the end of the year. If money isn't an issue right now and you're really afraid of getting a job and having to owe all the money back, just choose the last option and then you're going to pay full price for your health care now and it'll be reconciled as a tax credit at the end of the year. Or you can choose the middle one that says you can, and then you can choose a percentage to use. If money is an issue and you really need health care and you're squeezed right now, choose the first issue, the first one, the first choice, which is use 100% of it now, and you can reconcile it at the end of the year. There's another new question that they added in that said, did you receive a premium tax credit in 2014? And if so, did you reconcile with your taxes? It's Form 8962 and then 1095A or something like that. My understanding is that if you went to Jackson Hewitt, H&R Block, something like that, and had your taxes done in 2014, they didn't have the Form 8962. So nobody filed an 8962. It might be 8940. They'll ask you that. If you didn't get a subsidy in that year, just skip it. Don't check the box, don't anything. Because you didn't reconcile it. The answer is no, just don't check. The way the site is set up, it's not yes, no. It asks the question and then there's a box. There's no clear option if you want to say no, there's no clear box to check. It's just move on. If for some reason you did get a subsidy in 2014 and you didn't fill out your 8962 and your 1095A, what's going to happen is when you get your subsidy determination, and I know this because I just did it for a client the other day, it's going to say, we're not going to give you a subsidy until you file your 8962. So you're going to have to go to irs.gov, get your 8962, you're going to have to fill it out, and you're going to have to upload it to healthcare.gov. And you're going to have to call them back and say, I filed my 8962. Again, it's all about numbers. What they're doing is they're saying, you got a subsidy for 2014 and 2015, but you didn't file your taxes, so we don't know if you actually owe on that, if you were lying to us, if you put in a fake income, anything like that. So that's what that is all about. If you got a subsidy in 2014 and did not file your 8962, you are not going to get a subsidy until you file your 8962. Again, it's not that big a deal. You go to irs.gov, download it, and it's basically a sheet that says, January, what was your subsidy? What did you pay? What was your total premium? February, what was your subsidy? What did you pay? What was your total premium? And at the bottom, it's going to say, what was your income? That's all it is. Just a breakdown of numbers. Those are the most confusing questions so far.
Backing up a little, if you're deciding if you're young enough and healthy enough to go without insurance, do you know if under new administration, pre-existing conditions are gonna?
Nobody has any idea. That's one of the great unknowns. Are we all clear on the money part? That's what I get most questions about. Okay, so after you get through all that, you get your subsidy elevation, it's going to say, determination, say, congratulations. Next steps are, choose a qualifying health plan, this is your subsidy. You got to go to the next page. And you're gonna see 3 plans. You're gonna see Ambetter, which is Superior Healthcare. You're gonna see Sendero, and you're gonna see Blue Cross Blue Shield. And you're not even gonna see Blue Cross Blue Shield until page 2 because they're so much more expensive than Ambetter and Sendero that they don't even show up on page 1. If you're gonna get a subsidy, the silver plan is what you wanna buy. The reason is, under the silver plan, you also get cost sharing, which is gonna dramatically reduce your deductible as well as your co-pays. Now, it is not your cheapest option. The bronze plans are still going to be cheaper than the silver plans. So if keeping your bottom line as low as possible and only using healthcare in the event that something catastrophic happens, then you can choose a bronze plan. If you plan on using your healthcare at all, you go for an annual checkup, and you may go 3 or 4 times a year, maybe you have something you need to do quarterly, maybe you need to get some 3 or 4 prescriptions filled, a couple prescriptions filled every month, something like that, buy the silver plan. Under the bronze plans, you're gonna pay for everything out of pocket until you meet your deductible, which is gonna be $6,300. You're gonna pay for everything out of pocket. You still get the discount, you get the insurance discount, right? So you go to Austin Regional Clinic, and they say, Mr. Johnson, normally it's $180 to see you today, but because you have Ambetter, it's gonna be $150 today. But you're gonna pay $150. They are not copay plans. Silver plans where the copay plans start, and then there's one, I think there's 1 or 2 gold plans. There are no platinum plans available. They are all HMOs. There are no individual PPOs available in Texas. Not one. They are all gatekeeper policies. All of them. If you're moving over from United Healthcare, Humana, to Blue Cross Blue Shield, or Ambetter or Sendero, yes, you're going to have to choose a new primary care physician, and you're going to have to go see them. It's just the way it works. If you're switching, if you take some medications and you're moving from Humana to Blue Cross Blue Shield, all insurance carriers have different contracts written with different pharmaceutical companies. So I may take ABC drug with Humana, and I may move to Blue Cross Blue Shield, and they may say, we really want you to take XYZ drug. You don't have a choice. If you decide and you say, nope, I'm sticking with ABC drug, you're going to pay for it. What they're going to do is they're going to say, well, we'd like you to try XYZ drug for the next 90 days. If it doesn't work for you, then we'll see about switching you back. If you say, nope, absolutely not, I'm going to stay with ABC drug, then they're within their rights to tell you you're out of network.
If you've already tried an ABC drug, can your doctor override that?
Yes and no.
Okay.
They're under pressure not to, but theoretically they could. Now, whether it's going to be considered generic tier 1 or tier 2 under the new plan is going to be the question. Because what's considered a tier 1 drug under one plan may be a tier 2 drug under another plan. Okay, so your price may go up. Okay. Primary care, you have to see your primary care once. It's going to be auto-assigned to you. It's going to be within a certain mile radius. It's going to be within a certain mile radius, that kind of thing. You have to see them once. If you don't like them, they're a jerk. You can always switch. But you have to see your primary care once. You can't just call up and go, oh, I don't like that guy's picture. I want a different primary care. Okay, we're going to move through this pretty fast. Ambetter and Sendero run on the Medicaid network. You're going to be going to Lone Star Circle of Care, that kind of places. Nothing against them, I'm just letting you know. If you go to T.J. Johnson's Family Practice because your grandparents went there and your parents went there and you want everybody to go there, they're not going to be in network. The only people that are in HMO networks are the large public institutions. Seton, Austin Regional Clinic, Austin Diagnostic Clinic, those kind of places. I can about 90% guarantee you that if your physician works for their own practice or for a physician's group, they're not going to be in any of the networks. If you see specialists and you switch carriers, you're going to have to go back to your primary care and they're going to reassign you a network specialist. You can always pay out of pocket to go see who you want to, but it's going to be a nightmare to get those results accepted back into your network. Because what the insurance company is going to say is, well, we want our expert to make sure that your expert knows what he's talking about. This is the face of what we're living in right now. So again, Blue Cross Blue Shield has fairly robust network. They're Austin Regional Clinic and there's Seton. They are not St. David's. Ambetter and Sendero just added Seton Ambetter, I'm not all that sure about. But they're the cheaper plans. The Ambetter and the Sendero plans by far, by several $100s a month, are going to be the cheaper plans. For my family, what we may do is sign up for the absolute cheapest plan under Ambetter that we possibly can, and only use it if something catastrophic happens, and then pay out of pocket to go see our doctors. Because the difference in premium is about $500 a month. And we don't use $500 a month worth of health care. So it's cheaper for us to pay out of pocket to go see our own doctors, 10 times a year, than it is to buy the Blue Cross Blue Shield plan, which has our doctors in network. And then just use the Ambetter plan as catastrophic if I have a heart attack or break my arms or legs or something like that.
And if when you hit your deductible limit, what is the benefit?
When you hit your deductible, it's going to be either 70, 30, 80, 20, or 50, 50, which means that the insurance company is either going to pick up 80%, 30%, or 50% of whatever comes after that. The real number that you want to know is what is my out-of-pocket maximum. The out-of-pocket maximum last year was $6,350. I believe it's $7,150 this year. The out-of-pocket maximum is the only number that matters after deductible. The out-of-pocket maximum is the maximum amount of money that you will have to pay for all medical expenses in a year. So you can have a triple bypass, a stroke, and break both of your legs 3 times and a $4 million bill. The most you will have to pay is $7,150. That's for a single person. That is the 2017 out-of-pocket maximum, and it goes up by CPL every single year.
Out-of-pocket maximum is after you paid the
Yeah, so you pay. So let's say your deductible is $5,000. You're going to pay, and you have a heart attack, and your bill is $100,000. So the first thing that happens is the insurance company. You get all these bills. The insurance company gets all these bills. The insurance company says, "Well, we're not paying a single one of these until you give us $5,000." So then you give the insurance company $5,000. And then let's say that you have 50-50 insurance, which means that after that, the other $95,000 is split 50-50 between you and the insurance company. Until you've paid $7,150. So that's $2,150 more than the $5,000. Once you get to that $7,150 ceiling, you're done. Whatever's left of that $95,000, the insurance company covers. They actually write it off and tell the doctors to go screw themselves. But that's what they do. So the out-of-pocket maximum is the maximum amount that you're going to pay. You're going to pay your deductible first. Once you've met your deductible, then you're going to pay the remaining between the deductible and whatever your out-of-pocket maximum is. Clear? It's confusing. I know that it's a weird way they do it. Now, understand that under your deductible, there's a lot of things that don't count. Your copay doesn't count, right? So you go to the specialist, $100, and you have a $1,000 deductible, and you pay $100 to see your specialist, and then you say, "Wow, my deductible's down to $900." No,
But you're out of pockets.
your out-of-pocket is reduced by $100, but your deductible is still $1,000. Your deductible only comes into play with certain things, like if you're admitted to the hospital, or you have surgery, or something like that. Your out-of-pocket, everything counts towards your out-of-pocket maximum, prescriptions, copays, anything like that. Only medical care counts towards your deductible. Here's another thing that I'm going to go over, and then I'm going to wrap it up. If you go in for surgery, so anesthesiologists, nothing against them, are the #1 cause of insurance headaches and pissed off patients. And there's a reason for that. So I go in for surgery, and now by law, the anesthesiologist has to come in and sit in the room, and they'll do this with you. They'll come in and sit in the room with you, and you'll get to ask them all the questions you want to when they're prepping you, when the doctor's talking about your surgery, and you're not supposed to eat for 24 hours and all this other kind of thing, right? And the anesthesiologist will be in that room, and you will say, and they will say, "Mr. Johnson, I'm going to be your anesthesiologist. This is what's going to go on, da-da-da-da-da-da-da-da." And I'm going to say, "Great, are you in network?" And they're going to say, "Absolutely, Mr. Johnson, we're in network." And I'm going to go, "Okay, great." And I'm going to go in there, and I'm going to have my surgery, and everything's going to be hunky-dory. Now I'm going to get out, and I'm going to be in the recovery room. Does everybody have this happen?
Yeah.
Okay, so I'm going to be in the recovery room, and I'm going to be on pain medication. I'm not going to drip, and I'm going to be on pain medication. And after 10 days, I get out, everything's fine, I do my rehab, and then about 3 months later, I got a bill for $5,000 from the anesthesiologist, and I call my insurance company, I go, "Oh no, I shouldn't be paying this, I paid my deductible already, they were in network, everything's great." And they said, no, you're responsible for that bill. So I get on the horn of the anesthesiologist, and I say, "Hey, what's going on? I thought you told me you were in network." "Yeah, we're in network." "Okay, so why do I have a $5,000 bill?" Because we were in network during your surgery, because we were in network with the hospital. We are not in your insurance company network. So all that pain medication that you got out, that you had for the 10 days when you were in recovery, is out of network. And you now owe for it. Also ambulances, same thing. Also when you're in the ambulance, and this happened to me, and they go, do you want oxygen? You say, I don't know, do I need oxygen? And they say, well, most people take oxygen. You're gonna pay for that. It's not covered because it's optional. Insurance will not cover that. Also be very, very careful. You're gonna get a weird bill, and you're gonna say, well, man, I saw the doctor at your hospital. He's an independent contractor. He doesn't actually work for the hospital. So although you were in a hospital facility that was in network, the doctor gets to charge his own fees, and we don't have any control over it. He can charge whatever he wants to. That's why I can't tell you, regardless of what plan you pick, I cannot tell you what you're going to pay for that. Nobody can.